The following data is from a recent Nevada Primary Care Association report highlighting the growth of Nevada's fqhcs in 2019. Nevadans are served by a total of 17 health centers headquartered in 5 states. Nevada has 41 fqhc clinic sites. 39 are operated by fqhcs headquartered in the state. 2 sites are operated by an fqhc headquartered in California. Far more fqhc clinic sites are in urban counties. However, there is a higher share of rural clinics than rural population. Health centers in Nevada served 107,480 patients in 2019. Total patients grew by 8% between 2018 and 2019, an improvement from recent annual growth. Nevada's fqhcs delivered services through 338,102 patient visits in 2019. The 7% increase in the number of patient encounters is similar to the rate of growth in recent years. Change in visit volume are notable for a 16% drop in dental visits in 2019. Medical visits, with 7% growth, saw the largest percent increase since 2015. Other visit types have seen rapid growth in the past year. Mental health visits increased 54% from 2018, while SUD visits increased 183% from a relatively low base. Meanwhile, enabling services dropped 45%. And finally, here is the composition of all visits from 2010 and 2019. Over this time, medical visits grew by 40%, while dental visits only grew 11%. Mental health, SUD treatment, and enabling services all have impressive growth rates because they were not or barely offered in 2010. fqhcs in Nevada grew their mental health services nearly 11,000% to become the second largest visit type category. The COVID-19 pandemic led Nevada health centers to implement significant changes in a short period of time. We started a daily COVID-19 task force that is now meeting twice per week. As a group, we make decisions based on science, communicate effectively and timely, are transparent about confirmed cases, and collaborate with different departments. We have also been following closely the CDC and WHO, as well as national organizations like the American Academy of Family Physicians and the American Academy of Pediatrics. Here are some of the changes we have implemented. Front screener protocol, checking temperature and inquiring about symptoms for every patient, visitor, and employee who enters a Nevada Health Center facility. An algorithm to determine which patients to see in person and whom to treat via virtual or telephonic appointments, including telebehavioral health and teledentistry. Screening protocols to determine which patients to screen for coronavirus. Point-of-care COVID-19 testing in 3 of our sites. We have our Nevada Health Center nursing team telephonically following up with patients who are tested for coronavirus. Our Nevada Health Center pharmacies offer mail order and curbside pickup. We also do a rigorous personal protective equipment inventory and facilitate distribution to our sites. And of course, we have all hands meetings. During this time, we have been cognizant about continuing to move forward with providing high-quality primary care and preventative services. During the pandemic, we have started a medication-assisted treatment program for patients with opioid use disorder, an HIV opt-out protocol, and moved forward towards clinic redesign, including team-based care initiatives. NVPCA REACH Program Innovation Highlights. On the 50th anniversary of the nation's only family planning program called Title X, NVPCA is proud to support and collaborate with the following reproductive education and care in community health homes program partners: Community Health Alliance, First Person Care Clinic, Northern Nevada Hopes, and Nevada Health Centers. As part of the nation's family planning program, these fqhcs deliver high-quality, comprehensive, integrated family planning services across Nevada. Since the REACH program's inception in spring of 2019, over 4,900 Nevadans have received comprehensive, evidence-based reproductive health care. 14% of REACH patients are males, and 67% have incomes below 100% of the federal poverty level. These patients account for over 7,000 encounters at REACH health centers. 100% of REACH partners are delivering reproductive care via telehealth. The REACH network is one of very few Title X programs nationally, with 100% of providers offering telehealth to meet patients' ongoing family planning needs. Over the course of a few months, the REACH program implemented a state-of-the-science data system to electronically collect, validate, and analyze family planning data. Community Health Alliance received national kudos for creatively distributing reproductive health information and condoms during the initial COVID response. REACH partners gather regularly for program updates, to share information and to distribute best practices. These gatherings are called REACH-outs. This collegiality has provided much-needed peer support while delivering essential patient care during disturbing times.
In 2018, someone died of an opioid overdose every 11 minutes in the United States. The response to the opioid overdose crisis needs to be a holistic one that includes access to evidence-based treatment. Community health centers are a really important part of helping to fill the gap in access to addiction treatment.
Over the past year, under especially daunting circumstances, health centers in Nevada have innovated by integrating primary care with medication for addiction treatment, or MAT. 3 health centers implemented or expanded SBIRT, an evidence-based intervention to serve youth and adults. Health center teams actively learn more about cultural humility to best serve patients suffering from opioid use disorder who hurt not only from the disease, but also have endured the stigma it carries. And our fqhc partners received customized billing and coding training to improve the sustainability of their MAT programs.
Nearly 80% of Americans with opioid addiction don't receive treatment. And there are lots of reasons that this happens. One reason is because we know there's not nearly enough access. Recent estimates suggest that 40% of U.S. counties don't have a single buprenorphine prescriber. Additionally, we know that people with addiction have often been treated really poorly by healthcare systems in the past, and this may impact how likely they are to try to engage in services given their past negative experiences. Community health centers can be a really important part of both filling that gap in access to treatment and also ensuring that people with addiction receive empathetic and respectful care.
I would often hear patients say, my parents won't even talk to me anymore. They said that I'm a lowlife. I've thrown my life away. So there's already so much guilt and shame on these individuals that where do they really have to go? There is no positive reinforcement. There is no positive conversations they're really having.
Our patients tend to have a lot of challenges. Usually, by the time they get to us and are enrolling in a medication-assisted treatment program, a lot of times they have for lack of a better term, burned a lot of bridges. Their addiction has taken hold, and oftentimes they have lost family and friends and multiple jobs.
My role in it is that I am usually the first contact with the participant. I start that process of building a relationship, which I think is extremely important because a trust factor has to be built. Most times participants come to a medical clinic for medical services, and they tend to have a hard time talking about their drug use.
There are so many people in the United States who need access to evidence-based addiction treatment services. To be able to adequately address the gap in treatment that we have in the United States, we need community health centers to step up and start delivering these services in a respectful and supportive way.
So I really enjoy what I do because I get to listen to people's stories. And I think that's something that I didn't really expect when I started this job. A lot of our patients have stories to tell, and nobody's really listened to them. So it's, how did they get where they are now, learning about their families. At the end of the day, our patients are people just like everybody else, and it's getting to know them on an individual basis and having them come in and smile.
Too many people have already died of opioid overdose, and it's important to remember that overdose deaths are completely preventable. Opioid addiction treatment is effective and saves lives. Community health centers have an important role to play to treat our entire community, which includes people who use drugs. It's on all of us as health center staff to make sure that we welcome and engage people who use drugs in a respectful and supportive way.
Since April 2020, the Southern Nevada Community Health Center has provided COVID-19 testing. We have also utilized the Southern Nevada Health District's East Las Vegas location and mobile unit for testing at various locations across Southern Nevada. We have also partnered with All Saints Episcopal Church to use their space to provide testing as well. Further, we have recently opened 2 temporary buildings at the Southern Nevada Health District main office on Decatur, one for COVID-19 testing and the other for housing for those who have tested positive for COVID-19 and need temporary shelter. In addition, during this time, the Southern Nevada Community Health Center provided ID Now testing machines to the following community partners: First Person Care Clinics, Nevada Health Centers, Silver State Health Services, and University Medical Center of Southern Nevada. As of August 31st, 2020, the Southern Nevada Community Health Center has completed 18,088 COVID-19 tests.
Hi, I'm Sharon Chamberlain. I'm the CEO for Northern Nevada Hopes. I'm so excited to welcome you to this virtual tour of Hope Springs, our bridge housing project right here in Reno. Bridge housing is a model that provides services, intensive services for individuals in short-term programs. About 6 months, individuals will live in this program. They'll have their own individual shelter. They'll be able to have a community and a sense of belonging. They'll be able to rebuild their lives with the help and support of our incredible staff at Northern Nevada Hopes. So you might ask, why would we even begin to do this as a community health clinic? Why would we get involved in housing? We know that housing is health care. When people are housed, they have better health outcomes.
Hope Springs is this wonderful 0.92 acre parcel here in downtown Reno. The idea is that we're going to be providing free housing for individuals that are transitioning from living on the streets into more permanent housing, and this is that middle step for us. Hope Springs is a total of 5 pods, each pod consisting of 6 homes. Each home's 98 square feet, and these will be available to our residents as early as 2021. Each tiny home will be fitted with an AC unit and windows, screen doors, and porches, so that way we can really encourage that neighborly feel within Hope Springs. We also have a community garden and fruit tree set up. This is so that people can raise their own food and learn to grow it and learn to prepare it here in our kitchen here at Hope's.
My name is Alex Johnson, and I want to share my story of hopes with you. At 58 years old, my life turned upside down. After losing my loved ones, my job, my homes, I started on a downward spiral, and I wandered the streets. I rode buses at night. I slept in the park during the day. I thought my life was over. May in 2017, I walked into Hope's and asked for help. Finding a home was the most important first step. I needed a home so I could get a job, but I needed a job so I could get a home. When I could shave for the first time in weeks, it was like being alive again. Clean clothes, a place to call my own. It's just one letter between hope and home. And when you have hope, then a home is possible. When you have a home, hope is possible. Now I have an incredible job. I've got love in my life, and just yesterday I applied to actually get a home. We're not looking for handouts. We're looking for a hand up.
Hi everyone, my name is Greg. I am the project manager and medical technologist expert helping First Person Care Clinic on the creation and implementation of the Progressive web app. After COVID-19 pandemic had first hit our country and started changing the way we live, Ms. Valentin sat with our medical research technology team experts to discuss innovative ways to improve their fqhc services in general with a direct impact on social interaction, health and well-being, efficiency, secure and advanced data collection. In our meetings, we talked about her work experience since she had started working at First Person Care Clinic, challenges and organizational goals, among other health center needs. Over the last 3 years, Ms. Valentin has been working tirelessly with board members and clinic staff to make sure First Person makes positive impact on business, society, and their health center future. Based on their needs and present circumstances, First Person Care Clinic decided to start and create their own Progressive web app. What's most exciting about the Progressive web app technology is there's no need for an app store, there's no download required. The app is delivered through the web browser, and users can instantly add to their home screens for instant return access to everything important for the clinic. So I'll go ahead and open up the browser, and as you can see, when the browser is open, the user will get the prompt to add the app icon to their home screen and opt in for push notifications. I've already added the app to my home screen, so I'm going to go ahead and open the Instant Progressive web app. Again, there's no download, no app store. They add the icon to their home screen and they have instant return access to everything important for the clinic. We use a secured private cloud, so patient information is not shared with other internet platforms. Conversations are not recorded, among other secured features. Patient can easily share the app via email. I'll tap on the share button. They can tap and share the app through email, Facebook, Twitter, and if they're still in the browser, they can send via text message, or direct instant link can be shared for users, for all of their friends or an individual user as well. Patients can also find the nearest locations. So I'm going to go ahead and go to the Contact tab. As you can see, the app does have access to location services, so they can quickly see which location is closest to them. They can also make appointments. So there's an appointment tab here that's instantly available for them to go ahead and reserve their appointments for future appointment, and upload documents. Patients can also send and receive individual and group push notifications. So there's a mailbox up in the top. As you can see, it says there's a message waiting with the red dot. So that's the notifications panel. Notifications are also delivered through the browser. So as you can see here with the app icon and the message there. The system also has the ability to track data in general and specific to the health center's needs. We are very excited to offer the progressive web app and all of its capabilities in the industry.